We're going to talk about something pretty heavy today, based on a brand new study out of Somalia. And it all boils down to one devastating question. What if trying to get better, trying to get healthy, was the very thing that pushed your family into poverty? For millions, this isn't a what-if scenario. It's their reality. So let's unpack this.
All right, so here's our game plan for this explainer. We'll start with the personal side of this, then we'll pull back to see the bigger national picture. We'll get into why things are so tough, and then crucially, we'll look at the road ahead, what the potential solutions might be.
Okay, first up, the high price of health and what it actually means for an individual, for a family.
I want you to really let this question sink in. What if getting sick meant losing everything? You know, for many of us, a health issue is scary. Absolutely. But what if it wasn't just a health scare? What if it was an instant financial disaster where the very medicine that's supposed to make you better could wipe you out completely?
Well, in Somalia, that isn't a hypothetical. It is a stark, everyday reality. And this number says it all, almost 45%. That means that nearly half of all the money spent on healthcare in the entire country comes straight out of the pockets of ordinary people.
And just to be crystal clear, when we say out of pocket, we're not talking about a monthly insurance premium or a small copay. No, this is the hard cash people have to scramble to find right then and there for the doctor's visit, for the prescription, for any test they need. It is healthcare at its most raw and, frankly, most brutal level.
Okay, so that's the story for one person. But what happens when you zoom out and look at the whole country? Well, the numbers? They're pretty shocking.
And look, this isn't just some abstract economic model. The researchers actually went out and talked to people. They surveyed 2,000 households all across Somalia. So these statistics we're looking at, they are grounded in the real-life experiences of families.
This chart right here really puts it all into perspective. Just look at Somalia compared to the rest of the world. The global average for what's called catastrophic health spending is under 12%. In sub-Saharan Africa, it's about 16.5%. But in Somalia, it's 24%. Wow, that is a massive jump. We're talking about nearly 1 out of every 4 families facing potential financial ruin because of medical bills. So what does that word catastrophic actually mean in this context? Well, the technical definition is when a family is forced to spend more than 10% of its entire income on these direct health payments. You can imagine, that is the tipping point. It's the line where a medical problem officially becomes a full-blown financial crisis. And a huge reason for this, as you can probably guess, is that there's basically no safety net. Get this, only 3.5% of Somalis have any kind of health insurance. So when a medical emergency hits, there's no one to share that risk with. The entire financial burden lands right on that one family. They're completely on their own.
So you might be wondering, where is all this money even going? The answer is pretty surprising. Look at this breakdown. A whopping 54%, more than half of it, is just for medicines. We are not talking about elective procedures or anything optional here. We're talking about essential, often life-saving drugs. And that's what's pushing families to the brink.
And you know, behind every one of these statistics, there are real people being forced to make just impossible choices.
So how do people cope? How do they pay these bills? Well, the survey found that half of the families had to borrow money. 30% had to sell off their assets. Things like livestock or a piece of land, things they depend on for their future. And maybe the most heartbreaking part, 20%, 1 in 5, had to cut back on other essentials, like food for their family or taking their kids out of school. Just devastating.
There's a quote in the study that just hits you right in the gut. It says many Somalis are caught in a precarious situation where seeking healthcare can itself cause economic hardship. Just think about that cruel irony. The very thing you do to get healthy is what can plunge you into poverty.
So you have to ask, why? How did things get this bad? Let's dig into some of the root causes here.
Well, it's really a perfect storm of problems. First off, government spending on health is extremely low. That means the system is mostly private and unregulated, so you pay for every single thing you get. We already know there's basically no insurance to help spread that risk. And on top of it all, the country's national economy is fragile. And since so much of it is informal, setting up a formal insurance system is just incredibly difficult.
And to understand why the government can't just step in and fix this, well, look at this comparison. Somalia's tax revenue is only 2.6% of its GDP. The average for other African countries is 16%. That is a massive difference. When you have such a small tax base, there's just not enough money in the national pot to fund public services like healthcare.
Okay, so it all sounds pretty bleak, I know. But the good news is this study doesn't just diagnose the problem. It actually lays out a prescription for change. There is a path forward here.
So here's the 5-point plan they recommend. Number 1, start small with insurance. You pilot community-based programs that people can actually afford and trust. 2, protect the most vulnerable people right now with things like health vouchers or direct cash transfers. 3, increase public investment. The government needs to put more money into health, maybe using some savings from recent debt relief. 4, go after that biggest cost driver, medicines. Regulate those prices and push for generic drugs. And 5, keep track of everything. You need good data to see what's actually working.
So, let's bring it all home. What's the ultimate bottom line? Why does all of this matter so much?
Because here's the thing. This isn't just a healthcare issue. Not at all. When you protect families from these crippling health costs, you're not just making people healthier. You're actually fighting poverty. You're creating economic stability. Really, you're upholding a fundamental human right.
And that leaves us with this final, really big question. And it's one that goes way beyond Somalia. In a world with so much wealth, how do we make sure that the cost of staying healthy is never, ever the reason someone falls into poverty? It's one of the defining challenges of our time, and honestly, it's something we all have a stake in figuring out.